Hi, it's Tara. Today I want to talk a little bit about labels and how some of those labels can really limit us and our potential for healing and for growth, and some of the dangers of really over personalizing with a diagnosis or a label that we've been given. And one of the reasons this came to mind, aside from the ones that I see in my practice where people really, their illness, physical or mental, has become their entire life and changed their entire identity. It's really been this trend of people tattooing symbols and statements on their bodies to help. The movement is to help reduce the stigma about having a mental illness, talking about it. And I think it's really important that we work on that stigma. I am concerned when the identification and the personalization of that label becomes a permanent fixture in somebody, whether it's literally on their body or it's something that they just have really adopted as a limiting factor in their life. What we know is that people have good days and bad days with most illnesses, and so that tells us that the state, the experiences of the symptoms that we're having can change, and so that there is potential for it to improve. We don't know the course of therapy or the percent of improvement that a person could have on any disease prognosis, but what we do know is that when people are given a deadline, when people are given, this is a forever thing, this is a chronic forever state that you'll never get out of, that becomes truth. Whether it is actual truth or not, it really becomes truth, and it limits people's creativity and their ability to fight forward or be open to new ideas of healing. One of the reasons that I know this is a powerful limiting factor that I'm concerned about is from one of my own experiences. When I was 17 or 18, I herniated a disc in my back while I was training at the gym and was in excruciating pain. I went from being a top level competitive athlete, I was a dancer, I had just started my professional career, and I went from that to crawling from my bedroom to the bathroom just to get around. And so as I went through the healing process of that, the disc in fact did heal and correct itself, but the pain didn't go away. I spent the next 2 years and 13 different specialists going through a really emotional, scary time trying to figure out what this chronic, lasting pain was all about. And I was still so young, so it was a really confusing time. I can appreciate how confusing and emotional any diagnosis of a chronic illness, mental or physical, can be. And there was a sense of relief when finally they did come up with a name for it. The problem with that name was it was a condition called fibromyalgia that they said would be permanent. They would medicate me with SSRIs and muscle relaxants, but this was something I was going to deal with and would be limiting for the rest of my life. So at 19, that was a really hard pill to swallow, no pun intended. And it did limit the first decade of my adult life. Every limit that they told me I would face, I did. And I didn't know about SRT, this kind of work we would do to regulate the nervous system, or any other healing modalities that might impact my prognosis. So I became what they told me based on that label, that collection of symptom experiences in that moment. That was a limiting factor for me. And so now I've done some work. I've done SRT. I actually no longer have asthma, and I was on corticosteroids for 35 years. I no longer have fibromyalgia. And all of that by regulating the nervous system and really being open to not being limited by any label, not owning it. I had to look at the way I talked about it. Instead of calling it my fibromyalgia or my fibro days, I eliminated that speech from my vocabulary altogether. I didn't talk about it unless I was working on it in a positive SRT session. Once my nervous system got regulated, all of those symptom patterns disappeared. I'm not saying that this is going to cure anything, but what I'm saying is there's a potential for healing that we will not be able to fully realize if we hyper-personalize any disease or syndrome label. It's not a guarantee that we're ever going to get any better from anything, but you have a greater chance of even getting 10% better and 30% better. 50% better is magnificent for so many people that are suffering from any chronic pain condition or depression or anxiety. But that possibility is out there, and you have a greater chance of accessing it if you are not limiting yourself with the label, with talking about it a lot outside of your therapy sessions. If, as an experiment, you were to put a moratorium on the way that you talk about your current chronic conditions, instead of calling it my anxiety or my depression, what if you only talked about it with your healthcare providers and really started to build an awareness about how much it's taking up the rest of your life? Really think about what your potential of healing could be. Imagine what it would be like to be 10, 30, 50, 100% better. You have a greater chance of reaching those potentials in any health condition if you're doing the right kind of work and if you're having the right kind of mind frame. I don't want there to be stigma about anything that you're suffering with. There certainly was stigma with being 19 and having fibromyalgia and having people think at that time that it was a psychosomatic issue. But there doesn't need to be that shame, because there is room for improvement. So really look at how you're talking about it, how you've allowed any label that somebody's put on you from any professional, and really see if that's true for you, or see if there's a potential for change. There's always a potential for things to get better. I encourage you to really be open to this. I know it's hard to let go of that, and to let go of that acceptance that you've struggled so hard for when it comes to any illness. But if there's an opportunity to have a window for potential, for hope, I encourage you to check into it. Look into SRT for some of this work. A regulated nervous system is your best chance of healing for so many different things. A dysregulated nervous system is really the beginning of a lot of different disease processes. So be open to some new things. Be courageous in this area. I encourage you to do these experiments and see how you've adopted these labels. Until next time, I hope you're well.